Well, this fight is about opening the government, protecting healthcare, and preventing the massive hikes in healthcare costs if we do not address the Affordable Care Act tax credit. And if we don't, costs can go up to $7,000 to $18,000 for working people and families across the nation, including right here in the district.
How long do you anticipate the shutdown will last, and how will this directly impact your constituents?
Well, we need to open the government right now, but unfortunately, Republican Speaker Johnson canceled work next week. And so he first needs to get us back to Washington, D.C., and he needs to speak with the Democrats so we can come up with a good bipartisan solution.
What are some of the negotiation tactics that Democrats are looking at to negotiate with Republicans?
Well, at this point, we're just asking them to show up to work and speak with us, because this is not about a line item in the budget on a spreadsheet. This is about real-life experiences. Federal workers as early as next week will not get their paycheck. And I've already spoken with labor leaders. I've spoken with some of the local organizations. They're going to have difficulties buying groceries, paying for gas, paying their rent, utilities. So I'm working to connect the federal workers with the organizations so they can come up with agreements and support and resources to meet their basic needs. This is not fun for them. That's why we need to take this seriously, and Republicans need to call us, Speaker Johnson needs to call us back to work. They need to show up to work, and we need to start talking about ending this government shutdown, because it's all about healthcare costs. It's all about protecting healthcare. They refused to put the Affordable Care Act tax credits in the big ugly law, which already cuts Medicaid by about $1 trillion. It's going to leave 15 million people uninsured. It reduces funding for hospitals by $600 billion, which is going to cause hospitals to close, premiums to go up with limited resources.